pay attention to their symptoms. Flares may happen. If they do, if you have a flare of symptoms, please contact your rheumatologist. You may be put on a short course of steroids, and that would only last 7 to 14 days. Sometimes, if flares continue, you might have to change your medications. If you have flares of just 1 or 2 joints, sometimes an joint injection of a steroid will do the trick. The rheumatologist will go into the joint with a needle and just inject some steroids directly into that joint capsule, and that will help you improve. We will continually monitor your blood work and give you questionnaires to follow so that we can really understand how well that you're doing. So you really want to stay on top of getting your blood work done, which is going to be about every 3 months, and coming back for your follow-up appointments. So what can you do to improve your quality of life when you're living with RA? You can reduce stress. You can try to protect your joints the best you can. For example, spring comes and you want to garden, that's your favorite hobby. Don't try to do it all in one day. Really monitor the amount of time you're spending and take frequent breaks. You may also consider raised flower beds so that you don't have to do so much stooping and bending. You may also want to consider ergonomic tools or tools that are built specifically for an arthritic hand. You may also consider a splint that would protect your wrist that you could wear when you're doing an activity that would tend to be difficult on the wrist. In all cases, you want to protect your joints. So the next thing you want to do is you want to get some exercise. You don't have to join a gym, but if you do, that's fine. Develop a walking program, even strengthening exercises like lifting weights. They would be light weights, but you could lift weights. The next thing you could try is yoga or Tai Chi, which are nice movement exercises that also can help develop your strength and balance. Lastly, you want to quit smoking because we know through data and studies that have been done that smoking makes RA much worse. So if that is something that would be within your control, then we would hope that you could stop smoking. There are a lot of different lifestyle changes that you can initiate to really help you manage the disease yourself. It doesn't take the place of the rheumatologist, and certainly you can work with your rheumatologist to come up with some of these changes that you might want to make.